Millions of lives are at risk following U.S. President Donald Trump's executive order to suspend foreign aid for 90 days. U.S.-aided funded programs are shutting down operations as the Trump administration turns off the taps. But what does this mean for the people dependent on these programs, especially when it comes to HIV/AIDS programs? And are we likely to see an increase in new infections? Let's unpack this now with health journalist Joan van Dyk. Joan, a very good morning and thanks so much for your time. It's been a couple of days since we heard this order from Donald Trump. What's been the impact of his decision over the past couple of days, especially on HIV/AIDS clinics and programs, those dependent on PEPFAR?
Thank you for having me. The impact since the announcement late on Friday was sweeping and immediate. But the situation is actually changing really quickly. The latest is that the State Secretary Marco Rubio has actually waived some parts of the executive order that came through on Friday afternoon, which means some of the health workers are actually able to continue helping as part of USAID projects, but the wording of that waiver is not clear on whether that includes HIV prevention. So PrEP pills, I'm not sure if you can hand out those through USAID projects, and also it doesn't include any support for LGBTQ communities, especially trans communities. So it's not a blanket relief. But to give you an idea of what happened on Monday and Tuesday, the funding freeze is very different from a stop work order. It means that thousands of people had to drop everything. Some meetings ended in the middle of the meeting. In South Africa, there were a number of nonprofits who closed even before there was any official communication from the Department of State, which is where USAID, where the agency lives. Clinical trials that are ongoing also had to stop immediately, and USAID in South Africa supports a lot of LGBTQ projects, and for other groups that are very at high risk of becoming infected with HIV, sex workers, queer groups, drug users, and so on.